Safe practice of anesthesia is certain international standards have been set so that it will be safe for the patients as well as to the hospital administration. And also, if you provide safe anesthesia, there are a lot of problem of legal suits and other things can be avoided. So, the World Federation of Society of Anesthesia, they prescribed this set of standards way back in 1992, then modified it several times, and their recommendations can be classified into highly recommended, recommended and suggested. These are the three types of suggestions or the recommendations that they give, and it is applicable throughout any elective procedure from patient evaluation until recovery. That is what the whole thing depends. And however, for immediate life-threatening measures, always take precedence in an emergency. So you cannot follow all the strict rules in an emergency. So you have to first concentrate and save the life of the patient. So this is the 2010 guidelines that have been given, which is called the General Standards where professional status. You should always have a qualified anesthetist. And because in those days there were non-availability of qualified hands, only MBBS basic doctors were giving anesthesia. Even sometimes nurses were asked to give anesthesia by open drop technique, which was considered quite safe also. But nowadays nobody will accept. So you should have a qualified person, and there should be professional organizations which provide standard teaching and have the supervision of training and continuing education. There should be periodical updating of your knowledge. And so training, certification and accreditation is very important. And we must maintain proper records and statistics. This is also part of the safe anesthesia technique so that you can go back and see what right or wrong that you have done. And peer review and incident reporting. This also becomes a very important point. I think these two things I think we are not mentioned here in the isn't it?
Yes, sir.
So this also should be included in your answer. So confidential discussion of appropriate topics with multidisciplinary professionals also, and protocols should be developed and deficiencies corrected. So by doing all these things only you can improve and make the anesthesia more safe. And workload has to be correctly uh, allocated so that you prevent undue fatigue and physical demand from the organizing personnel. And what type of personnel should be there is also given some guidelines, and they should be responsible from the start of the anesthesia, whether it is general, regional or monitored anesthesia care, and should be there throughout the transport of the patient also to post anesthesia recovery unit. And they are the person who are overall responsibility lies with them during the recovery period also, and should be readily available for consultation until the patient has made adequate recovery. And if you are handing over to somebody from looking after a patient, there should be a proper protocol which should be followed so that the person gets all the relevant information about patient history, medical condition, anesthetic status, etc. And the anesthesia professional should ensure if aspects of direct care are delegated before, during, or after anesthetic care. So, if long operations, when a team changes over, there should be proper handing over so that the continuity in treatment and patient care will be maintained. And you should have proper facilities, equipment available, which you mentioned, including traditional operating rooms and also in other areas wherever anesthesia is administered. And the use of checklists, very, very important before you start any procedure. So, peri-anesthetic care and monitoring standards, you should have a pre-anesthetic checkup done for all the patients and ensure all necessary equipments are present and they are functioning correctly. That also should be checked. And the assistance available or needed and assistance is competent to give help whenever necessary before you start the anesthesia. Then This is pre-anesthetic check. This is the routine evaluation of the patient healthcare institution, and the anesthesia team and anesthesia location should be executed prior to each anesthetic. So this is the usual form that we use for recording the pre-operative findings. Then monitoring, which she mentioned, you should have an uninterrupted oxygen supply, and you should measure the oxygen concentration. The oxygen supply failure alarm also should be there in all the machines, and prevent misconnections also. Then oxygenation of the patient should be done continuously, and pulse oximetry is highly recommended. You cannot do any surgery without pulse oximeter. Airway and ventilation should be done in the proper way. Breathing circuit is used and the reservoir back should be observed. And when mechanical ventilation is employed, make sure that the disconnect alarm is working so that any disconnection can be easily picked up. And continuous measurement of inspiratory and expiratory gas volumes. That is, the tidal volumes of all the things is suggested. Even though it is not compulsory, it is better and safe to have these things. And circulation wise, must measure the cardiac rate and rhythm, and physically palpating the pulse also is recommended now and then, so that you can be sure that the patient is normal. And the electrocardiogram is only recommended and not compulsory all the time, but better to have that also. And defibrillator is also recommended. For tissue perfusion, you should have the clinical examination, continuous monitoring of pulse oximetry, and also continuous monitoring of capnography. Temperature monitoring, means of measuring temperature should be available, especially in long surgery where patient is likely to become hypothermic. Then neuromuscular function, you can use a neuromuscular monitor. Depth of anesthesia also you can monitor, so that you know, because these are available nowadays, you can assess the degree of unconsciousness. And audible signals and alarms should be present in all the equipments that you are using. Coming to post anesthesia care, the facilities and personnel should be according to the particular standard. So you have the all patients who have an anesthetic affecting central nervous system function or loss of protective reflexes should be anesthetized until recovered or transported safely with careful monitoring. During transportation also, it is preferable to have a pulse oximetry and BP monitor going on. And intraoperatively, all observed monitors should be made appropriately, and pain relief should be taken care of, prevent and alleviate post-operative pain. And so these are all the things what we normally do are all to be written, which are part of the safe anesthesia practice, so that the patient has no pain intraoperatively and be able to have a smooth course of anesthesia. Right.
Hello, sir. Good evening.
The new topic.